This morning, our hearing is employer wellness programs, better health outcomes and lower costs. Senator Murray and I will each have an opening statement, then we'll introduce our panel of witnesses. We'll ask we have your statement, so we'll ask you if you could summarize your comments in no more than 5 minutes. That'll leave us more time for questions and interaction. The Senate is voting today, so votes are scheduled to begin at 11, which means we'll probably conclude the hearing about 11:15 or 11:20. We'll stay as long as we can, have as many questions as we can. And if there are any additional questions by senators or if things come up that you would like to say to us, please submit them after the hearing's over. If we're going to have a conversation in our country about enabling high-quality, low-cost insurance, we probably should start with roughly half of Americans who have insurance through an employer, health insurance. That's 159 million Americans, more than the 54 million Americans in Medicare, more than the 69 million Americans in Medicaid in the Children's Health Program. Today we're going to hear from employers who are helping employees lower their insurance costs through employer wellness programs. There's a lot of support for this idea. Senator Murray and I were with Secretary Burwell yesterday morning, and she was talking about her announcement Monday that signals a willingness to work with employers to reform the way that we provide health care to workers, which includes wellness programs. In a similar vein, wellness programs are turning the table on the health care system, making it more oriented toward the individual. How do we help people be healthy instead of curing them when they're sick? I hope we can learn three things today. How well are the programs working? Are the regulations that the government has regarding wellness programs working, or do they need to be improved? Is the General Counsel of the Equal Opportunity Employment Commission discouraging something that promises to lower Americans' health care costs? Now, it's no secret Obamacare was not a bipartisan law, but it did include a bipartisan provision to strengthen workplace wellness programs. Senator Harkin, Senator Murray, I, and many Republicans worked together during the Help Committee markup of the Affordable Care Act. Before the Affordable Care Act, employers relied on a 2006 regulation that empowered them to discount employee premiums up to 20% for making healthy lifestyle choices. Today, employers have the certainty of law that they can offer their employees up to 30% of all their off all their premiums for doing things like maintaining a healthy weight or keeping their cholesterol levels in check. The law also gives the Secretary of Labor and Health the authority to extend this discount to 50% through regulations, and the secretaries did just that for tobacco cessation. But these discount programs aren't a blank check. Under the Affordable Care Act, employers must have to meet several conditions. They can't discriminate. These programs have to be available to everyone. There have to be a reasonable alternative if the employee can't complete the program's standard requirement. They have to be designed to promote health. You can't offer a reward for better job performance, but you can for stopping smoking. And third, you have to be able to qualify at least once a year. To get started, employees might fill out a questionnaire about themselves and their family's medical history. Then they'd work with a medical professional to improve on that. That information could only be provided to employers in the aggregate under federal privacy laws. Employers seem to think these programs work. They're rapidly adopting them. A September survey last year showed that 18% of employers already use outcomes-based wellness incentives. 48% plan to add one by 2017. Some of the witnesses today will tell us that well-designed plans can be very effective. Are they working as well as they can? Do you have all the tools you need to know? And what about the EEOC's attitude? Is that a problem or is it not a problem? In that case, the General Counsel sought an injunction against Honeywell, which seemed to make the argument that any sort of premium discount the company offered to its employees for participation in the company wellness program made that participation involuntary. Well, we had a lot of discussion here in the committee about on the Affordable Care Act about the importance of allowing companies to provide premium discounts in exchange for wellness programs. And we want to make sure we don't have a countervailing move going on in the government to discourage that. Even the White House has expressed concern regarding the EEOC's actions. When asked what the president thought about the EEOC wellness lawsuits, the White House press secretary said the administration is concerned because these lawsuits could be, quote, inconsistent with what we know about wellness programs and the fact that we know that wellness programs are good for both employers and employees. Congress was clear in the health care law. The administration was clear in its regulations. White House has reiterated its support. Employers are adopting these programs. We don't need confusion. And if confusion persists between different government agencies, I will work on legislation to provide clarity. But hopefully there's a lot of good news in today's testimony about what employers are doing to make health insurance less expensive for employees in exchange for employees leading a healthy lifestyle.